for 5 minutes of questions.
Thank you, Mr. Chairman. I just do want to start just by pushing back against some of the Republican claims and some from my colleagues that these abortion bans that are completely extreme and out of step are outside the scope of this hearing. Now, to use their own words, this hearing is about a, quote, one-size-fits-all protocols promoted by politicians that eliminate the decision-making power of patients and physicians, end quote. Now, we know that abortion bans have deprived women in 22 states of access to abortion and criminalized doctors seeking to provide the highest quality care to their patients. They have assaulted the reproductive freedom and bodily autonomy for more than 25 million people. House Republicans advanced these bans before the pandemic, during the pandemic, and continue to do so this day. So with all due respect, I disagree, and I think it's critical that we ensure this hearing addresses the doctor-patient relationship, especially when it comes to abortion bans. Now, today we're also, unfortunately, enabling extremists who claim that masks are child abuse and that vaccines don't work. It's appalling, it's embarrassing, and it's endangering American lives. Now, the House Republicans have built an entire platform around controlling women's bodies, banning health care for LGBTQ plus people, and putting corporate profits over the health of everyday Americans. As a committee, we should be coming together to protect public health and fighting to make medical care more accessible for all Americans. But instead, House Republicans are working to undermine the doctor-patient relationship and push essential health care out of reach for women, LGBTQ plus people, low-income Americans, and seniors. Now, the truth is most doctors and medical professionals continue to support common sense guidelines about pandemic response, just like they overwhelmingly support access to abortion, gender-affirming care, and HIV prevention. But right now, Republican leaders are working overtime to restrict every single one of these things, even over the explicit protests of doctors, patients, and medical experts. Now, over 20 Republican-led state legislatures have criminalized health care for LGBTQ plus people, forcing families to travel hundreds of miles and even flee their communities to access life-saving, medically recommended care. And it's also estimated that nearly 400,000 transgender adults live in states that are considering legislation to ban health care that they actually depend on. This is almost 500,000 Americans. And this doesn't stop at trans people or the broader LGBTQ plus community and their families. Far-right leaders are so desperate to continue their attacks on LGBTQ plus Americans that they're targeting critical medication that prevents the transmission of HIV. In March, an extreme Republican-appointed judge in Texas struck down the Affordable Care Act's free preventative services requirement, all because of a culture war vendetta against the very existence of gay people. And I know this because I, myself, am part of the community. Now, Mr. Chairman, medical providers are pulling out of already underserved communities in Republican-led states explicitly because these policies infringe on their ability to care for patients. Doctors are being threatened with legal action for simply providing safe, effective, and medically necessary health care, all because extremist points of view have decided their top priority should be interfering with people's most personal medical decisions and the doctor-patient relationship. Dr. Shane, I want to ask you, given your perspective as an expert in infectious diseases, I want to ask you about the importance of accurate science-based public health information. First of all, how important is it for government institutions to provide patients and physicians with clear and consistent public health information, especially during an ongoing pandemic?
Thank you for the question, Representative Garcia. It is absolutely critically important that information is available, that it is accessible, that it is interpreted and communicated to families and patients.
And is it fair to say the overwhelming majority of physicians, including infectious disease doctors that you're representing today, supported efforts to get Americans vaccinated?
Absolutely, yes, we do.
And I want to add also, I was mayor of my city for 8 years. We have our own health department. We don't use the county system. We run one of the largest health departments in the state of California, and we pushed to get everyone vaccinated. And that was on the advice of the overwhelming majority of doctors. So I want to thank you, Dr. Shane, for being part of the medical community that actually worked to save lives, not to try to cause disinformation that actually got people killed during the pandemic. I want to also ask you, are individuals, including political leaders, who spread misinformation about vaccines endangering public health and costing American lives?
Thank you for the question. Yes, unfortunately, when misinformation is spread, that has tremendous adverse effects that impact not only the individual, but the entire community.
Thank you. And I want to, again, add that it's really unfortunate that we continue to push vaccine hesitancy, not just on this committee, but across the country. And with that, Mr. Chairman, I yield back.